darling. There you are. You see, I can always just chat away whilst I'm just kind of getting the mood back up. But we have got questions, Shabir, which finally Lucy is here. So we're just going to get some questions out.
Sure.
All right, Lucy.
Great.
Okay, so how much does diet affect Hashimoto's disease?
How much does diet affect Hashimoto's disease?
I mean, I think it's important when you're looking at Hashimoto's disease to think about an anti-inflammatory diet, because obviously it's affecting the thyroid gland, or has affected the thyroid gland, and we don't want to cause inflammation. So basically it does make a difference, but as long as you follow an anti-inflammatory diet, you should be fine. So
Okay,
basically the Mediterranean diet would be good.
Okay, the Mediterranean diet. All right, Lucy, next question.
Okay, how can bring my hormones back on track?
How can I bring my what on track?
My hormones back on track after giving birth 10 months ago, still breastfeeding.
How can I get my hormones back on track when I've been finished breastfeeding?
Theoretically, we should not be introducing anything else. The body should be able to allow to recover itself.
Mm-hmm.
And taking things like a vitamin aimed to take during pregnancy and beyond would be a good idea, because zinc, for example, helps to normalize hormone levels. For some women, it can take just a few months, and for others, it can take a year or so to normalize.
Okay, great. Thank you. Next one, Lucy.
I have a crop of red hormonal blemishes along my jawline that won't go. Help.
I have a crop of red hormonal blemishes along my jawline that won't go. Help.
So have you considered something from within? Because obviously, if they're red, they're showing you that there's some form of inflammation occurring, which is disturbing the cells there. So you've got to consider a cleanse of some description. Something like a clear skin complex would be great. Clear skin works for literally most inflammatory skin conditions. So we're talking acne, eczema, across the board, rosacea, across the board. Something like that. So clear skin complex, and perhaps think of something to enhance cell turnover, like retinol, gentle retinol or bakuchiol, to try and...
Okay.
You know.
We're going to come to this one, Lucy. There's a question here, but this is a question we ask so often, Shabir, which is hormonal hair loss.
Yeah. Well, hormonal hair loss is associated, we think, the theory still stands, and it's been going on for years now. Hormonal hair loss is associated with a decline in female hormones, which results in the dominance of testosterone. Now, our bodies work with all hormones within very finite levels. So when there is a dominance of testosterone in your bloodstream, the body converts that into a metabolite, into a compound called DHT. And DHT is inflammatory in nature. So as it's circulating, reaches the scalp, disturbs the signals of keratin production, it disturbs the signals of repair processing, things like that. And eventually you shed hair. So there are supplements aimed at it. I mean, Superior Hair is one that I know you've recommended.
Yeah.
It's probably one of the best ones I've come across. It works very, very specifically for hormonal hair loss, but it works for other types of hair loss as well, because it's still got the nutrition in there, like biotin, silica, things like that.
Yeah. I mean, I take that and biotin. I have to say I take both, and I think, you know, the combination I really think works. And also, I mean, you talk a little bit, and Jill talks more about this than you, Shabir, but about fulvic acid and how that has a contribution, because I know there's a spray.
There's a fulvic acid mist which you leave on overnight. And basically fulvic acid is one of these very complex molecules that holds 65 plus minerals. The idea of fulvic acid is to nourish those follicles with minerals, because apparently, according to Professor Linus Pauling, every concern has a mineral deficiency associated with it.
So we just get the minerals right in our body,
Correct.
And we should generally be quite well.
Quite well.
Okay. Biotin is spelled Bioitin. and you can get it from Solgar. There's lots of biotin. Fulvic acid is actually from Victoria Health, and it comes in a mist and a foot cream.
It comes in a nail cream, a mist, a face cream, and it comes in a shampoo, conditioner, and an elixir to drink.
Fantastic. I mean, okay, Lucy, next question.
Okay, what other than D3 can I take to boost my mood?
Okay, somebody's saying, what other than D3 can they take to boost their mood? I presume they're saying vitamin D3, Shabir, and we know the benefits of
vitamin D3 is
a
known
sun
as,
substitute.
it's known as the sunshine vitamin because it actually, we make it when we expose ourselves to the sun, but it also has an influence on all the neurotransmitters in the brain. It specifically does enhance the increase in serotonin levels in the brain. But you can take so many things. I mean, as we said before, you could theoretically take Magnolia rhodiola. You can be thinking in terms of saffron. Saffron is a great herb.
Saffron, that's really interesting. Hello, New York.
The spice saffron is great at elevating serotonin in the brain. So that's another option.
Can I ask you, Shabir, if you cooked a saffron pudding, would it make you happier? Well, depends if it was tasty.
It should do. It should do. I mean, you don't need a lot of saffron. As you know, it's a concentrated spice.
Well, it's a very expensive one because I remember in India getting it from the market, and I literally got this little vial, and it was sort of, 10,000 rupees or something.
Exactly.
Yeah. Okay, great. Next question, Lucy.
How can you identify a low mood coming and prevent it?
Tricky that to answer.
It's very difficult because how can you identify that's something that's going, that you're going to feel worse off in a few hours' time? Yeah. Very difficult.
I mean, I think
one would know individually that, one feels slightly less motivated, perhaps.
Yeah. I mean, I've had different guests on Shabir over the last few days, and one of them was a hormone specialist from New York. And she said, quite controversially, but she said that, a lot of people are put on antidepressants because of mood, but if they'd had their hormones balanced beautifully, maybe for some of those people, there would not be such a need to go straight to an antidepressant.
Sure. I can't. I understand.
Yeah, no, I appreciate you're not, she's a doctor, but I think that when somebody says, how do I prevent that mood that might be coming on? A part of me just wants to say, do get your hormone levels checked. Sure. I want to throw that out there as a piece of advice. Sure. Because if your hormones are really out of kilter, I know for me, when they were very out of kilter, I was very low.
Well, we know even cyclically, for example, I mean, women go through the period and they can be really low, and then within a few days, it's all back to normal.
Yeah, like nothing ever happened. That's my daughter, in a nutshell. Mr. Casting is saying that's very true, I was misdiagnosed. I don't think that's controversial. Anyone with hormone issues will know this is true. Doctors not listening to me about my hormones. I think that's the hardest thing, Shabir, is the amount of women who come on this and just say, my doctor just said, I can take it or I can't take it. Or there was no big conversation. There was just like ticking a box.
Listen, I completely understand it, but I think it is one's right to ask for a hormone profile. Yes. And I think you've got to be persistent in your practice, or perhaps even consider a change. I mean, I'm not saying change a doctor, but some women will do that and they will go to the next practice. But of course, at the moment, it's almost impossible to get to a practice.
It is, and this is, we're talking about when things get back to normal. Because I don't think this is the time in which it's going to be easy to prioritize that as a test. Yeah. But in times when things are easier, I would say exactly what you said, Shabir. If you have a doctor and they are not prepared to do it, you might want to go and see somebody else in the practice and just say, I really feel that it could be my hormone levels. Please, can I get them checked? There are the way you normally get them checked is they do blood tests, and those blood tests tell you your levels, and then you can be diagnosed with supplements accordingly, or with bioidentical hormones, or with
hormones as well. Bioidentical hormones would be compounded for you specifically, which is a great way.
Yeah. Okay. Next question, Lucy.
Can you recommend a good all-round multivitamin, including collagen and vitamin C?
Okay, somebody wants just to take one pill a day, Shabir. They don't want to be me. Then it can include vitamin C and what's the other thing?
Collagen.
What? Collagen.
Collagen. I mean, there are vitamins that are being sold out there with collagen, but it's difficult to get sufficient collagen and all the vitamins in one a day tablet or anything like that.
Yeah.
So we definitely do not sell anything like that. I can tell you that right now. We sell some of the finest food state multivitamins on the market, but our collagen supplements are always kept separate away from a multivitamin because of the fact that you need a lot of collagen in order to get some through the bloodstream, through the gut into the bloodstream.
And I think we've had chats about that because there are a lot of companies that sell collagen supplements in a pill form, and the likely chance they're going to get to your skin and improve it is like that.
Correct.
And I think drinks can be full of sugar. Some of the high street brands you find in Boots in our big pharmacies in the UK, which I think you're going to get more sugar damage than you are going to get benefit from the modicum of collagen that's in those drinks. But there are different types of collagen, and there's a product which I just started taking, which is Life. Do you have that still in stock?
The Life drink.
Yeah. What's in the Life drink exactly? Isn't that a combination of...
Well, Life drink is a very, very deeply nourishing drink. So what it contains a whole series of green foods. It contains green vegetables. It contains blue-green algae. It contains a small amount of omega-3, 6, and 9. It contains probiotics. It contains digestive enzymes. It's almost like just a nourishing drink that supports your immune system. It carries on supporting your immune system.
And I think what's interesting is the lady who just asked that question. I don't know the answer to this, but I'm just going to say that it could be she heard she should be taking vitamin C and collagen. But in fact, something like a really nurturing drink with a ton of those ingredients you just mentioned is so much a stronger support for the body if she just wanted to take one thing.
Absolutely.
Yeah. Okay. We'll do the last question now, Lucy.
Oh, pressure.
Deborah, they are still shipping. Shabir, are you still shipping?
Yes, we are.
You are. Deborah, who's one of your customers from Germany. She's in Munich. And she's saying, are you still shipping? And Skin Clay just ordered the Life drink from Victoria Health. Looking forward to try this. Karen, I have the Life drink. Can I take it in addition to a multivitamin?
You can take it. It's not necessary, but you can take it. Okay. I would continue with my Life drink first. I think it's so nourishing. I don't think you need another multivitamin. Yeah.
There's a lady who has been asking about these spots that she's had since Christmas. So I think looking at your diet, and she had them on her back. I'm just going to say one tiny thing about spots on the back, Shabir. It doesn't apply to all people, but it is something that a lot of women, if they do their hair in the shower, and they're going like that, and the shampoo sits here, or it sits on the shelf of their bottom, and they don't, they think they got it all out on their hair, but there is a residue, and I do find that can really block pores and cause spots. So I just don't throw that.
And I certainly heard the other day that spots on the back could also be a sign of adrenal stress.
Okay.
Because you've got a lot of
adrenals
on here and here.
Yeah.
And obviously cortisol increases sebum production. So that could be a sign as well. But I think the theory of the shampoo sits very well with me. I think it's very likely to be that.
Yeah. Somebody casting saying, I highly recommend the Hormone Clinic on Harley Street, affordable and worth a weight of gold. There are a number of clinics that do specialize in checking your hormones, and there are some very good ones out there. So if you get a personal recommendation, it's always good to check with girlfriends. You never know which of your girlfriends might be on some hormone treatment, and it's worth asking them and finding somebody they go to they like. I think personal recommendations are the best way ahead. Okay. Can you take vitamins with Roaccutane?
You can take vitamins with Roaccutane. I see no reason why.
I mean, I would say not to take vitamin A, just because it is a supplement to vitamin A.
You could take the beta-carotene, which is what is normally found in most multivitamin supplements, and take it away. So allow time between the two. If you allow time between the two, you should be fine.
Yeah. Okay. Ashwagandha. This is something that I haven't taken for a while now, and I'd like to take some more. Tell me why it's good. It does relax you a bit. Lucy,
So,
one second. Sorry.
ashwagandha.
Lucy, I'm going to close you down because we're getting so much back noise.
Okay, fine.
Thank you so much, Lucy. Say thank you, Shabir.
Thank you.
Bye.
Bye-bye.
And it's all going to become quiet. All right.
So, ashwagandha, otherwise known as Indian ginseng, so it's an adaptogen. So ashwagandha is involved in reducing cortisol, very much like the magnolia is involved in doing that role.
Yeah.
And ashwagandha, by mere virtue of reducing cortisol, allows the adrenals to produce their energizing enzyme. So it's a great energizer at the same time. And adaptogens work rather like a thermostat. They react to your body and then change and take action, so to speak.
Yeah.
That's the theory behind adaptogens, but
Okay.
that's how it works.
Thank you. Georgie is saying, is there anything that can be applied to the skin when the horrible sore hormonal spots come out? I mean, hormonal spots to me never come to those whiteheads. They're kind of those throbbing redheads, because I've had them when I've, been taking too much testosterone when I was trying to get my hormone levels. And I remember them well, just sitting there throbby. I think the quickest way to get rid of them is to have your hormones balanced. But I would not advise doing things like a sort of, these pinky looking products which you shake. Mary Badescu has them, one or two other companies, and they are silicic acid. Silicic acid is a really strong acid. And I always find if people, we get very upset by the redness and the throbbiness of a spot. So we put too much on it, and then the skin around it, doesn't, I'm going to pull out.
I must say I prefer azelaic acid is my preference as far as I'm concerned. I prefer azelaic acid to salicylic acid because it's very skin friendly. Yeah. It still does the job, albeit gently, but it does do the job eventually.
Yeah. I know that VH makes a very nice one. You can also get it on prescription. And I think people who've had very bad spots and now they're dealing with the scars, it helps too.
It's because it's involved. It does a similar job to retinol. Really, it's involved in cell turnover. It's involved in unclogging the pores. So it's doing the role of salicylic acid and it's doing the role of retinol combined together. It's one of those acids that seems to have missed on the radar by the beauty industry generally, but
it is. I mean, I'm glad you make one because there are very few people who do.
Yeah.
And if you want to get for the lady, poor Sazia Kelly, who's feeling up, really her skin is getting to her, try this acid and consider what you're eating and get your hormones checked. That would be lots of people have ordered your life drink. And the prebiotic that you recommend, Shabir, I mean, a lot of people say, should they be in the fridge and, how to use them? I know we said once you get them, they should be in the fridge. But
for general health, we recommend Mega Probiotic ND. It's a multi-strain probiotic supplement that once opened, I would prefer it kept in the fridge. It doesn't need to be, but I would prefer it kept in the fridge just in case.
Just stays the most active.
Yeah.
Shabir is the co-founder with Jill of Victoria Health, which is a fantastic online website, which has, I think, the best supplements that we can ever buy in England. Very well researched by both Shabir and Jill. They also have their own range of skincare called BH. It's a very big competitor to me, to The Ordinary, and I think some of the formulations are a little bit more sophisticated, but about the same price. Shabir, I'm going to say goodbye because there is this echo on the phone a little bit, but I would love that we could talk again and maybe think of another subject, something that we haven't covered recently. So if you want to have some thoughts,
I will,
and we'll be in touch.
Excellent. Thank you so much,
darling. So lovely to see you.
Bye-bye, everyone.
Bye-bye, darling.